In the year 2015, public health in Jamaica was in a deep, dark hole, was in crisis under the People's National Party. It was so bad that one young doctor, speaking on behalf of other doctors, made a big speech carried all over the media. Him say it is so bad that doctors have to use scandal bag to make scandal apron to perform surgery in the public health system under the PNP in 2015. And me say so. I him say so. In 2016, the Jamaica Labour Party took office. And we saw the challenges in public health. And we set out to fix it. We exchanged the scandal apron for a shopping bag, and we decided to go shopping to upgrade the health infrastructure in this country. And as Edward Seaga the Great would say, it takes cash to care. This government has moved the health budget from $60 billion in 2016 to $140 billion in 2023. You would ask the Jamaican people, what have we gotten so far for this increase in budget? Well, for the first time in history, under this JLP administration, 6 hospitals across the country are undergoing substantial renovation through construction. Spanish Town Hospital, Cornwall Regional Hospital, after years of neglect, is now being rebuilt as a new hospital. Western Child and Adolescent Hospital, in support by the Chinese government, is a brand new hospital. University Hospital of the West Indies and St. Anne's Bay and Maypen Hospital being built by Labour for the first time, the biggest construction project ever in the rebuilding of our health infrastructure, over $250 million worth of building. But you may ask the question, what does that mean for the average patient in a hospital? What does that mean for the staff, the surgeons in the hospital? Well, let me just give you a little example. What that will mean is that we will have some 30 brand new operating theaters between all those hospitals with all new equipment. It will mean over 500 new beds for patients who are waiting and can't get a bed added to the stock of beds in the public health system. It will mean all new equipment, MRI machines, X-rays, CT scans, and a more spacious environment for the patients and staff working in public health. We are building back stronger, active and strong under the Labour Party, based on where we are coming from back in 2015.
It's a party marching on to victory.
But we're not stopping there. Because again, for the first time in history, in this country under the Jamaica Labour Party, public health is going digital. $15 million spent so far. And if you don't believe me, go to Maypen Hospital, go to Spanish Town Hospital. Patient turn up for registration. They are registered on computer. Information move from registration area to doctor's office on the computer. And if patient has to be admitted into a ward, their personal data is transmitted to the ward space. What does this mean? It means easier access to records. It means that your file now going to last again because you have to go look for it in a filing room. It means better management of patients and also quicker analysis by the doctors. Building under Labour, active and strong, digitization of health records, which is going to continue under this Jamaica Labour Party. But I go further, because we have to compare in order to move forward with the plan that we have. In 2015, less than 1 million Jamaicans, or should I say 1 million prescriptions were written under the National Health Fund to give Jamaicans free medication or subsidized medication. Last year, 3 million prescriptions were written for Jamaicans right across the length and breadth of this country so they can access free or subsidized Medicare under a stronger National Health Fund. In fact, we have added 8 additional categories of illness, including treatment for cancers, which is very expensive, and 2 areas for diagnostic tests that have been subsidized under this Jamaica Labour Party. The National Health Fund is stronger than ever and certainly continuing to be strong to respond to the sick profile of our population. We're building, but we're not just focused on hospitals. We focus also on our community health center. Under this Andrew Holness government, we have put more money in upgrading and building out our community health centers than any other government in recent history. In fact, if you ask Farmer Joe, who live in Malvern, how it feels to go to the Malvern Health Center, or Miss Nicey down in Catherine Hall, West Central, St. James, how it feels to go to the Catherine Hall Health Center, they will tell you that right now, unlike in the past, we walk into an AC area. We have nice chairs to sit on. The doctor's quarters have been improved. The staff have kitchen to relax with microwave and refrigerator. We are upgrading our primary health care institutions like never before in order to encourage community health care. We're building out active and strong under the Jamaica Labour Party.
Come on and do your part. Vote for the best. Vote for Jamaica.
And so the Jamaica Labour Party is the right choice at this time. Because when we compare 2015 to today, we are well ahead and Jamaicans are better off. You know, if your son drop out of a mango tree and him having permanent teeth and him unfortunate enough to lose them, he can go to one of 75 dental health clinics in the public health system, measure up them teeth and get artificial teeth or dentures free of cost under the Jamaica Labour Party. We look out for the average Jamaican. And if you are unfortunate enough to lose a leg because of diabetes or some other form of illness, we have the New Limb, New Life, where you can register with the Disabilities Association and get a prosthetic leg so you can move around again. So labor rights, that is what we represent. Tangible, real impact. And so when they ask you, what have we done as a party in public health? First of all, we have inherited a crisis and we are building back stronger, active and strong. Now I am prepared to say, and I want you to listen to me carefully, that all is still not where it ought to be. I am in the trenches. I have seen the concerns. I face the music every day on behalf of this government and listen to the people. But if you compare 2015 with today, there is no doubt that public health is better off today than before under this Jamaica Labour Party.
Vote for Labour. Grab your Labour vote.
So I say to you, when they come and talk and they claim to have a plan, we want to know what that plan is because we are executing a plan. Things will get better. They are already better. And so I asked them the same question that they posed to us. How could we want to, as Jamaicans, go back to the days of 2015 with scandal bag making scandal aprons? What can go so, labor rights?
Mr. Guy, what can go so? What can go so? No, Mr. Guy, Mr. Guy, what can go so? What can go so? No, Mr. Guy, Mr. Guy.
I close by saying the following. Health is a partnership It requires all of us. It requires you, the Jamaican people. It requires us as government and cabinet, members of parliament, leaders, our international partners. And we want to proceed in this manner. I want to take the opportunity to thank all those who have been on board as we seek to expand and upgrade our health infrastructure. Our doctors and nurses, our healthcare workers. Although we are not yet where we ought to be, the truth is we are better off under Labour. The Jamaica Labour Party, active and strong, building back healthcare. God bless you. One love, Labour rights. God bless you, Jamaica.